My story, I think, started around year 7 for me. That's when I first noticed that I was feeling quite down all the time and I was very shy. My teachers noticed as well, so I got sent to the school counsellor and she noticed straight away that I had problems with self-harm. I don't really know why I started doing it. I don't really remember starting doing it, but I know that over the years it's just been such a big thing for me and such a bad thing for me. And it's something that I just couldn't stop, even though it didn't help. It just kept going and going and going. I kept it secret for so many years. I kept it secret from friends, from family. I didn't want to talk about it.
So most recent data tell us that around 1 in 10 Australian adolescents have engaged in self-harm at some point in their lifetime. There's also an increasing trend for hospitalisations for self-harm, and young women aged between 15 and 19 make up a significant proportion of that population. Improved data collection is also really crucial. The lack of monitoring that we have of this problem gives a really poor message to the community. And because most emergency departments don't have any standardised monitoring or reporting systems, the majority of presentations for self-harm don't actually get counted. So in fact, what we only hear about is the tip of the iceberg. This is made worse by the fact that most young people with self-harm or suicide risk don't actually seek help, largely because of the shame and stigma associated with these behaviours.
I have been hospitalised a couple of times, unfortunately, when I was at my worst. And the nurses and the doctors they dance around it. They don't really know how to be comforting. They're just doing their job, trying to fix you up and get you out of there, when really sometimes you just need somebody to be nice and talk to you about it and just explain things and talk to your parents instead of just telling them, oh, they've done this, goodbye.
The initial impact of self-harm for families and friends is one of fear and panic. Because self-harm is such a physical and visual condition, it's very difficult for families to confront it. And so therefore it's something that families really get very distressed about.
I think people find this behaviour so difficult and so challenging and so confronting that they actually lose the capacity to respond compassionately to these young people.
And I think a lot of the time there are lots of misconceptions and stereotypes about people who self-harm. We get called emo, cutters, attention-seeking, stuff like that. When sometimes, yes, it is for attention, but if we're doing this to ourselves, we obviously need the attention. We need the help. If somebody feels so bad that they want to hurt themselves, then they do need help from somebody.
I think families who have a young person in their life who is self-harming need to understand that there are services out there, but not enough.
The report highlights the critical need for some national leadership and policy direction on this issue. There's a clear need to invest in some evidence-based treatment and prevention approaches that can ensure the delivery of high-quality care to young people right across the service system. Services should also make better use of online and mobile applications that are highly acceptable to young people and can be delivered in an accessible and cost-effective way. There's also the need to build the capacity of the workforce. So evidence-based guidelines are required across the health sector, but also in education. But these need to be backed up with high-quality training packages delivered regularly right across the workforce, so to ambulance, to police, in health settings and in education settings.
It is about training clinicians to be compassionate, to use consistent language, to have good referral processes. It is about that, and we need a lot more of that. But it's also about training the whole community, of raising awareness about self-harm.
So they're the sorts of things that we need to be implementing. The young people we worked with when developing this paper really wanted to tell their stories. They want to be part of the solution. So we need to find safe and constructive ways to let this happen.
I've been dealing with this for quite a while, but today I'm doing quite well, I think, and I am very proud of myself. I didn't get to finish high school and I spent quite a while just doing nothing. But now I've got a casual job, I'm in uni studying, but at the moment, this is probably the only time in my life where I felt like I don't need to self-harm anymore. And it's been a difficult road, but I want to get better and I want to be the best person I can.